to today's session, I do like to remind everyone with regards our values and behaviours. It's important for us as we come together as a network that we want to continue to be a safe and supportive network. And that means about allowing everyone in this space this afternoon to have a voice, to be heard. We listen with curiosity. We feel brave to ask questions and pop your hands up, and we support each other to have a voice, and we respect people's opinions, observations and reflections. And where we may feel we want to challenge, we make respectful challenge. And we do that in a compassionate, kind and supportive way. So I'd just like to remind everyone that this next 45 minutes, please let's continue to support and lead by our values and our expected behaviours as a network, which you all do amazingly well. And thank you so much for that. Just to give you a bit of an update, so as a network, we continue to spread and with scale. We're now well over 1,500 senior operational managers and leaders connecting from one end of the country to the other. And when we start to include in those numbers the spread that we've now got by launching Proud to be Ops at a trust level, we're well into the thousands. So it's really fantastic to have the connection of our operational managers and leaders across the country. So please continue to be engaged. This movement is as good as your feet and moving it. So please continue to support us and engage with us, and we will do our utmost to keep ensuring that we support your development, your learning, your connectivity, and also we inspire and energise you, and we bring a bit of fun to it at the same time. If anyone would like to support any of our Sharing Non-Elective Stuff series, so we run 2 series as Proud to be Ops at the moment. It's the Sharing Non-Elective Stuff and also Sharing Elective Stuff that starts again this month. If you have got some great examples of operational change, improvement, nuggets of shining lights, then please do come forward and let's celebrate and share these fantastic initiatives that are happening from one end of the country to the other. So if you have got a great example, whether it's in a clinical service, elective care, non-elective care, please do get in touch with us. And we're always open to share and celebrate the work that we all do. One of our greatest assets is by the knowledge and experience we all each hold. So let's help share that in a very practical and meaningful way. What we have got coming up, so this month we've got further lunch and learn sessions, and particularly again with TeleTracking, and that's from their examples of work with the Countess of Cheshire, and that's on the 15th of April. We've also got launching this month a new webinar series where we've co-created with Sam Riley from the Making Data Count team a series of 4 learning webinar sessions around ops does data and information. And our first session is taking place in a couple of weeks on the good, the bad and the ugly of operational data and information. So please do get involved and sign up to that. All of our events and sessions, the majority of are on our website, and there'll be further information on that. We've also got a demystifying finance session coming up, and then at the beginning of May we will hold our first in-person Proud to be Ops event where we're going to be focusing on the development of operational managers. And really exceptionally overwhelmed with that one, where within under 24 hours we totally sold out of over 100 places, and we've got a growing waiting list as well. So we will be making those spaces available should any come available, but don't worry, we will have more in-person events throughout the year. And we're really proud and excited that in November we will have our Proud to be Ops annual Congress. And we're also doing a Proud to be Ops Awards ceremony as well as part of that in November. So a few things that are coming up, but again, please do head over to our website. Right, without further ado, may I say a fantastic and big welcome to Sean Briggs, who's a Chief Operating Officer, and Sally Foy, who's a Director of Ops and Nursing Flow, and both are from Maidstone and Tunbridge Wells NHS Trust, who are also joined by Davies, who's a Solutions and Strategy Director at TeleTracking. and they're here today to share with us their learning, their experience, and the partnership work they've been doing around bed and capacity management, which has been improving and helping patient flow. Now, I said they will share, and these sessions are as good as you have a voice and contribute. So please be brave and pop your hands up, be curious, ask questions. We'll allow our guests to share, and then we'll go into a Q&A session. I'll keep an eye out on the chat box, but again, please do have a voice and pop your hand up. So I'm going to do the fantastic next slide, please, for Sean and colleagues. But please, may I welcome and thank Sean, Sally and Carl. Over to yourselves. Thank you.
Thanks all. Nice to see everybody. Can we go straight on to the next slide? I think it's easier. We've done the introductions, and I think we'll just talk a little bit about who we are. So, yeah, my name's Carl Davies. I'm the Solutions and Strategy Director for TeleTracking. I'm a clinician by background. Worked for many years in the NHS. 90% of our team in the UK operations have worked either operationally or clinically in the NHS. And we've been around for around 30 years doing the sort of electronic bed capacity management. I joined TeleTracking around 2 years ago, purely because of the mission was sort of improving the quality of care and the urgent care pressures that was experienced on the ground. So all of the team have significant experience living and breathing on the ground in ops or clinical. And so delighted to be here to just talk through some of the work we've done in partnership and the now award-winning partnership that we have as a result of the HJ award last week. And we'll leave you just to say hello to Sally and Sean.
Thanks, Carl. Thanks very much for that. It was nice to win the HSJ award, but it's the first time we've won one in about 15. So we've had a lot of disappointment to get there. I'm Sean Briggs, Chief Operating Officer, and I'll hand you to Sally as well.
Hello everyone, nice to meet you. I'm Sally, nurse by background with 40 years experience in nursing and operational management. So happy to share our experience with you as we go through the session. So nice to meet you all.
Great. Next slide, please, Emma. So just because obviously this has become a big topic at the moment, electronic bed and capacity management system, and it means many different things to many different people, and we hear that across the patch that some people are slightly confused as to what the definition is. And fundamentally, we view electronic bed and capacity management as all of the steps that support the patient along the journey and in terms of the turnaround of the patients between the one patient leaving and the next patient entering the system. All of the different workflows that encompass that journey, working together and giving you full visibility of those workflows to help either improve, make more efficient, or automate where we can many of those processes. And so that's fundamentally what TeleTracking does. Where we can do it, we'll automate. So as an example, what you see in the top left there is we have a feature called Dropbox, which an auto discharge where you can take off the badge, you drop that in the box, that automatically discharges the patient from the system, and it alerts the cleaning team as to what level of cleaning is required for that bed, lets them know it's now empty. The bed site team can start to plan to use that bed, and then all of the individual workflows that stem from that all work in a similar vein. So if we just move on to the next slide, Emma. So what I'm sure you'll all be familiar with is where we don't have that level of granularity and information for all of those individual workflows, much of the flow of that information is reliant on people and paper to chase down that information. And what that does first and foremost is provide a very thin layer of information. You only really get the very top layer of information. It's quite superficial and often doesn't really help with a deeper level of decision that's required regardless of those patients. And it means that information often arrives late. We lose capacity in the system. We aren't able to maximize the use and the communication effectiveness of the staff that need to work together. That leads to delays, and then ultimately that results in impacts on quality of care. And so what we try and do is take all of those individual workflows and try and find the areas that are either losing time or we are essentially adding in additional work to try and track down information. So whether that's in phone calls, chasing things down, repeated visits to a particular person to get information, And we try and identify all of the different workflows and the data that's pertinent, and we give a deeper, more granular level of data around some of those workflows so that more effective and timely decisions can be made all the way across the path. So we just go on to the next slide. And the way that we can break that down is we look at the time that the patient spends in the bed, not physically in the bed, but their time and their length of stay from the second they enter and the decision to admit to discharge, and all of the different processes there. And we break those down and we work out where there is a pressure on time, where there is additional work, and where we can streamline and improve the process. And by lifting that up so that we've got visibility of both the length of stay and the time it takes to turn around the beds between patients, we can reduce both of those time periods and release more capacity into the system. The bit that's really important, and the bit that works exceptionally well, I would say, between MTW and TeleTracking is the fact that the partnership then is about how do we actually use that time and reallocate that time, and what Sean and team and Sally have done really effectively across the board at MTW is take that time, reallocate it across the system to use more effectively to support their pressures across the whole of the organisation. And that's testament obviously to the leadership there from Sean and Sally and the team there. Next slide, please. So I'll hand over to the people you really want to hear from, which is Sean and Sally, and they can talk you through the journey as you've seen from their perspective.
Yeah, thanks, Carl. I've got these two don't really trust me with many of the slides today, so I think this is one of the very few I'm going to actually get to talk about. These guys are absolutely the brains behind it. I think one thing I did want to say, I know this is not a sort of a commercial pitch or anything like that, but where we've been really lucky with this, and I know there are other systems out there, but TeleTracking have been fantastic partners from start to finish. So that for us has made a massive difference, and it's gone beyond sort of just a system. It's been about how we really support flow. And if we go back on this, actually, the idea behind this was it was a mixture of Sally, actually, who you are going to talk, who is going to talk to you more, and one of our talented general managers, directors at the time, who's now with another trust, actually, really bright guy. They both came up with the idea that we could do some of our patient flow management better. And actually we had an amazing site team. So going back, it wasn't sort of all broken. We had a brilliant site team. We have brilliant clinicians, brilliant staff working across this already. Really good, we've got a great relationship with our community trust, who've been amazingly supportive all the way through. But what we were just reliant on paper, as kind of Carl's already said. We were really reliant on paper, and you'd have that same thing I've done as a junior manager myself. That sort of annoying manager that's going around to the wards, pestering them about discharges. Have you got any more discharges? Taking up nursing time. Then somebody else goes around and does it. So, the ward manager and the ward staff are bothered endlessly throughout the day, as are the site team, basically just chasing up information through sort of clipboards and pen pads. So that's kind of where we were. Some of the sophistication around what the TeleTracking have brought in terms of sort of our idle bedtime and kind of the efficiencies we can get out of length of stay, and kind of then what the system gives us in our ability to really understand every element of where a patient is in the hospital and kind of the next steps. We've not even thought about some of that to start with. This really just started us. Our nursing time, our nurses, who are so valuable, such a valuable resource for us, are just having to spend so much time, wasting the time, taking phone calls, taking queries, being bothered by idiots like me coming around asking them again for the 10th time, have they got more discharges than the ward? So that's kind of where the drive came from. We thought we must be able to do this better. And that's where we found, I think Nick, who was our general manager, had found TeleTracking. We had sort of no prior links really at the time. So I started having some conversations with them, and then Sally, who I'm going to hand on to now for the next slide, kind of came to the trust board and the executive team to say this is something we really, as a department, as a medicine division and a flow team, we really want to go for. So I'll hand it over to the brains.
Next slide then, please. Okay, so this is just a snapshot of what our care causation centre looks like. And I think when we initiated the conversations with TeleTracking and introduced a bed management system, we kind of thought about how that can change the way we look at flow across the organisation. So we developed a care causation centre, which is facilitated. The data that you see on the screen is our flow data for the day. But it's more than that in that centre. We've got our transport department in that one single room. We've got our bed management team, so our bed allocation is allocated from this one room across both sites. We've got 2 hospital sites, so our bed management team are sitting in there. We've got our emergency planning team in there. We've got facilities in there. We've got our staff bank in there. So almost anybody in the organisation that's got an interest in flow and quality throughout the organisation is based in one room. So it is about bringing people together and putting the patient at the heart of all of our flow conversations, our quality conversations, and it now becomes data driven because of all the fantastic data that we've got, as you can see, in front of us all. So that's probably that slide. Next slide then, please. So I think the important thing is what has it delivered for us as an organisation. So in terms of operational effectiveness, you will know, all of you in ops, historically, we open escalation wards every year if we're in a position to do so. And for us, before our partnership with TeleTracking, those escalation beds, we would probably open in November, December, and not close them until July, causing causing pressures on staffing, finances, and everything that goes with escalation wards. But what it's allowed us to do over the last 2 or 3 years is actually we open our escalation areas in January and have been successful in closing them at least by March, early April. So that's a significant improvement for us. It probably saves us about 15 beds per day, and all of you, along with us, will have seen growth in ED. But what that's allowed us to do is to support that growth in ED, so we don't have long stays in ED. Our ED performance, as Sean will allude to later, is still very good, and we believe that this system has helped us manage that. The interesting one that we never really thought about previously is that you will know historically, in winter predominantly, surgery have a whole ward dedicated to medical outliers, and that hasn't happened for us. So what that's meant is that the surgical nurses that we were losing because they didn't want to look after medical patients are now staying. So we've got the right nurses with the right skill sets looking after the patients they choose to look after, which has been beneficial for us. I've already spoken about the co-location of services in the Care Coordination Centre. Our Care Coordination Centre has now become our single point of access across the organisation and with the system. So there's none of those, someone ringing Sean up one day, me another day, someone else the next day. It's all coordinated in that centre, which in itself has brought some efficiencies in terms of information sharing. We've already talked about improved flow and visibility. The other thing that it's done, some of the reports we get from the electronic bed management system have been exceptional. So we now have a very clear understanding of where all of our patients are on their discharge pathways, which means we can have daily PTLs to try and move the patient journey forward in a succinct way. And another thing that we often we don't talk enough about, in my view, is the quality improvements that this has brought for us. I think for any nurses on the call or anyone that understands nursing, the importance of getting the right patient in the right place first time. So it's absolutely supported us with that. Historically, we never knew where our patients were being held under mental health section were. We might think we've got 10 or 11, but we were never really sure. But this allows us to have a report directly into our inboxes every day, telling everybody where our patients are that are being held under any kind of mental health section. It's reduced our falls because we can allocate patients more quickly into beds, and we know where our falls risks are, so we can allocate patients more safely. And we can also have visibility of where our acutely unwell patients are, which we never had previously. So the quality improvements, I think, are probably understated in some of the conversations around electronic bed management. But if you've got one or you're having one, you will be surprised at how many quality benefits it brings to your patients. We talk about flow, but flow equals quality to me. So that's off my soapbox now. Next slide, I think, is yours, Sean.
Yeah, thank you. And you and Carl have touched upon this. In the sort of the time that we've been working with TeleTracking, we have, and look, we sort of talk about having good A&E performance. We sometimes challenge ourselves. We still think we should be doing better at the moment. But Sally's right. We've had mass attendances. We've had something like 30% attendance increase in the last 3-4 years. We've been able to shut some of our escalation wards, which has made a big difference financially, but also from a quality aspect as well, as Sally was saying. And we've been reasonably consistent with our A&E performance, again, in that period of time. Like I said, there's more to do. But the benefits for that, of course, when Sally talks about quality, when we talk about performance, for us, that also means our patients, we know patients will have worse mortality rates the longer they stay in our A&E department. We know that actually these efficiencies and working so closely with TeleTracking, and this is the next slide really, have enabled us to also make great inroads into our elective care backlogs. We don't have a 52-week backlog in our organisation at this moment in time. We're trying to eradicate 40 weeks. We're trying to continue to support the system. We work closely with some system partners around some of their waiting lists. And in the older, our elective care areas would just be filled with escalator patients. We wouldn't, we'd be cancelling elective patients and sometimes cancer patients at worst case on a daily basis. And the sort of the efficiencies they've given us has made a massive difference. And actually really has, and kind of the system, the sort of, I think the thing that Sally said as well earlier that's so important was that team environment as well, having the transport team, having all those, the cleaning team, the portering teams, having them as one team and being part of this has really made a big difference. Some of our proudest moments, Sally and I sometimes talk about, are sometimes when our cleaners, our porters come in and ask what the performance was the last day, and did we make it overnight? Did we get hit the number of breaches we should have hit the night before? It's that sort of one team impact, everybody being so important to it, has been massive. And I think while this, and look, like I said, TeleTracking has been an amazing partner for us, an absolutely amazing partner. But I think what the sort of my word of caution on this as well is it's taken a lot of leadership. So we know I've been blessed I've been in the trust 6 years. I've been really blessed with amazing leaders across the organisation, and sort of the leadership in some of those basics is so important as well. And it's every day still does feel like a challenge actually, but we've got amazing leaders that have really implemented this well. And it was a big change. It's probably, this is where I confess I've not been part of many digital projects that have gone that particularly well actually, especially with people, where it matters with people on the ground. But actually what really struck me about TeleTracking's approach, and again, some of our fantastic leaders, is actually it was the porters, it was the cleaners, it's the nursing staff that really like this system and find it really easy to, even I can use it. It's that good a system. And that has made a big difference to it as well. So I think we can, the next few slides are sort of trying to praising us about performance and what we've done since. But performance has definitely improved, and we're getting better outcomes for our patients in the 3 or 4 years that we've been working with TeleTracking. And I think so. If we skip through the slides, I'll not just sort of bore people by bragging. We have, honestly, we've gone for, I think I've lost 15 HSJ awards in the last 6 years. So to finally win one, the team actually cut me out of the presentation. I think that's why we got over the line on it this time. But Sally, let me hand back to you for lessons learned.
Okay, well, this may be a group effort, but I'll start us off. I think that we've described something to you that in theory sounds easy, but actually it isn't easy. And I think the cultural change that the organisation has been through has been significant. I think 3 years on, we're not perfect. We've still got improvements to make. And I think one of the improvements is still we haven't honestly embedded a cultural change across all of the organisation. So I think it's really, don't ever underestimate the cultural change. The rollout of this system, or any electronic-based system, was quite straightforward. I think it was 20 weeks or something. But sitting behind that is that huge cultural change that is actually much more difficult to manage. I think I've put know your users and how to structure their input, and use our partners to help us with that. I think we probably didn't do that at the beginning as well as we could, but we've certainly improved since then. I think the issue there is, I think that nurses will use electronic bed management in a particular way. Our pharmacy department will use it in a very different way, and our therapists will use it in a very different way. But I think what we probably could have done better at the beginning is understand all of those allied health professionals and what it means to them and the benefits that they will get from teletracking. So I think there's something about understanding the people that are going to use the system and probably looking at how we structure the change for them differently. I think I mean, I won't read the slide actually, you can read that, but I think my top tip from my viewpoint is don't circumnavigate the system, any system, whether it's teletracking or any electronic bedding management system. An example for us is the badges, so the wristbands that the patients wear that automate the services. We had a number of patients, dementia patients, that would pull them off and we would lose them. So we kind of circumnavigated the system and said, oh, well, we'll pin them to a door or whatever we done, you know, because we wanted to get the benefits. But actually, 3 years on, we're now at the process of going back again and actually embedding the process that we probably should have done without circumnavigating the system 3 years ago. So I think it's really important. We were really keen to drive things forward and probably didn't spend enough time actually working it through. We were quick to move on to the next step, So my advice would be work through the processes, don't circumnavigate the system. Otherwise, you've only got to go back and redo it. And also invest in the change. I think that we had we introduced this during COVID. So it's very difficult for us to get that kind of process investment with our teams. Everything was on Teams. It was all quite difficult. But I think a larger, huge investment in the change processes would be beneficial. And I think we probably could have done that better from an MTW viewpoint. Carl and Sean, have you got anything to add to that? Sorry, I'm just...
No, that's really helpful, Sally. I mean, I think I would just probably echo and go through each part. One of the key focuses for us at TeleTracking is that we don't just drop in the technology. That we learn lessons historically, and I'm sure we've all experienced it as providers, and I certainly have, where the technology is dropped in and then you kind of left to feel your way through that. And what that does is leave a lot of value on the table for both partners, and also it costs an awful lot of money for very little return. So from our perspective, we see and recognise the value of the partnership and actually using technology as an enabler of organisational development. So we can use that technology to help support the organisation to drive the change that is needed around people and process, and support them to make those processes more effective, so that we're not just taking the technology and mapping it to existing process. We think about how we can actually fundamentally support those changes that are required, and do that in the most simple and efficient way as possible. Secondly, the user roles and profiles. I think there is a major requirement of any technology provider to make sure that they understand the maximum value and how to get that, and how to support the structuring of that technology. And that means about how should it be used on the ground by all of the different user profiles, and how can we guide that. And that partnership becomes really, really important, because what we do is learn an awful lot from, like, Sally and the team around how we might adapt some of those kind of functionalities to support a different change of use or whatever that may be. But without that two-way partnership, you really aren't able to leverage that kind of value, and you can kind of feel a little bit disjointed and disconnected. So the importance of both partners on that is really critical. And also, finally, the circumnavigation of the system. We will undoubtedly find ways from the providers who are using it on the ground, about even with the best innovations, people that can find a way around how to use that. And that's actually a challenge for us, to make sure that we think about adapting the solution as we see fit, to make sure that we can support providers to make them to get the most value out of that. So I mean, I would echo what Sean had just mentioned about the importance of leadership. You know, the technology is fantastic. This can deliver significant value, but really, to leverage that value, you need really good leadership on the internal side. And we certainly make a commitment on that. And with Sean and Sally and the team, there's been some real value provided by their leadership, that we are really a supporting act along that journey, but one that we'll gladly play, because the proof is in the pudding in terms of what it can realise when you have that kind of partnership working.
Thank you. Thank you so much to all of you for sharing. I think there's some real powerful outcomes that you're achieving there. And Sally, I'm with you from a QI perspective. I think we can often not shine the spotlight on that enough. And actually, that is about that consistent measurement of the outcomes, and actually let's identify the quality and safety aspects of what we're doing here at the same time. So thank you for sharing. We have got some questions starting to come in, and I'm also going to invite colleagues as well to pop your hand up. Be brave. You usually are pretty brave in these sessions, so I'm feeling pretty confident, so don't let us down there. But there were just two or three things that I wanted just to pull out first, if I may. I think something really resonated with me, what we shared in a previous Lunch and Learn session, particularly around electronic bed and capacity management, was about this significant structural change. And I think you've also clearly articulated the significant cultural change. It's both a structural and a cultural change that is happening here. And actually, let's make sure that we give that due attention, time to nurture and grow it. And I think that's something, again, that came out really powerful. I think the other powerful is your results. When you do look at quantifying that over a 12-month period, it's significant. What you've just shared in terms of number of bed days, you know, reduced attendances or reduced actually admissions, it's phenomenal. And my third one is I absolutely love the fact of the one team. The porters, our nurses, our carers, our cleaners, our ED staff, etc. Actually, that true one team approach to supporting the quality and safety of patient care, which is what this ultimately comes back to, whether they're in a hospital site or in the community. I think that really shone through. So thank you for sharing that. I think there's some real fundamental learning points there. One question that has come up before anyone's brave enough to pop the hand up is there's curiosity with regards how you've approached patient consent with regards wristband tags. Is there anything that you've had to particularly introduce or adopt there?
Not from an not from an MTW viewpoint. There's no data, there's no information on there. It's just much like a iWatch that the patient puts on. So not from an MTW viewpoint. Carl, I don't know whether.
No, it's not something we, like you say, we're not capturing any data. That is purely for enabling a process, and really it just is about, it's not it's about just automating the discharge process more than it's about anything else. Sure.
Thank you. Okay, so nothing insignificant there or learning from any of the other partnerships you've been involved in to note.
Yeah, I mean, just quickly on that, I think we've had the old patient not wanted to put it on, but I think we've just managed around that, haven't we? I think that's the only other thing that sometimes the old patient will say, I don't want that wristband on, but I don't think that's been very rare, Sally, isn't it, over the time? So
yeah, thank you.
Thanks, Sally and Sean.
Oh, sorry.
No, thanks for that feedback. That was useful.
Oh, thank you, Jake. Apologies there. I didn't see you come in. Thank you. Ian, may I bring Ian into the space? We've got Ian Morris Jones. Do you want to come forward, Ian? Be brave.
Trying. Oh. Hang on. So I put it in the chat because it's going to be an echo. So I'll just put my question in the chat, if that's okay.
Yeah, the echo stopped now, Ian, but I can say it for you if it helps. Can I ask how much funding or investment has been made to date? So any maybe estimates or experience there?
I mean, I can quickly. I mean, look, I don't want to give away sort of TeleTracking's commercial information, but from a trust, I think it's probably important. I think that's probably one of the important things from a trust side. We did need to invest in our own team in this a little bit, actually, and that was, as I'm sure, in these tight financial, when we were implementing it, I mean, it always feels like it's a tight financial year, doesn't it? But it felt like a difficult financial year. It was just before COVID that we were sort of going through our governance process. And there is an upfront investment in this. So, I think if I remember rightly, the total cost of the business case, and that is including our own staff and development, was about 1.5, 1.6 million pounds of investment that was needed to be put in. And what I wouldn't underestimate, and Sally mentioned this, having a dedicated team of people that aren't, you know, we were really lucky. We had some good digital support from our IT team. We had some really, you know, TeleTracking were great supporters themselves. But it was really important that we had a bit of a dedicated team ourselves that were implementing this. And kind of to Sally's point, we probably under-egged that a little bit to start with, actually. We probably kind of thought we could get away a bit more lightly. And probably in the last few years, we've put more into that, actually. So there is definitely an upfront investment. I'll let Carl go through some of the TeleTracking. I don't know if he's allowed to talk through the numbers on the TeleTracking side. I mean, we're very willing to share our business cases of various things if anyone wants one. I know we have sent them to some trust in the past. I think but I think what I would say, and honestly, I've got no shares in TeleTracking at all, you know, and Sally will profess I'm the least digital person out there, so I've kind of got no particular skill set, or, you know, getting my computer on in the morning sometimes feels like a sort of a good day. But with this, what we have seen and kind of our commitment on this was TeleTracking have been great partners. So when we were looking at this, we wanted somebody that we knew wouldn't shortchange us. I've got to say, we've never had to look at the contract again. If I need something from TeleTracking, if Sally does, if the team do, we've got people on site that come to support. There's other people on the call, Dan Wadsworth in particular, and others that have been incredibly supportive and helpful with us on it. And we can easily look back now, I think it's about 4 years on, and say our sort of return on investment has been incredible. We sort of, in terms of, look at our bed base ironically has shrank despite our NE attendances going up in the last 3 or 4 years quite dramatically, and some of that's not all TeleTracking, some of that's SDEC, some of that's our emission avoidance, some of that's just better length of stay and pathway management. But a big part of that, we're sure, that's been enabled has been by TeleTracking and the sort of the investment we've made on it as well. So, and of course, by the way, I should say our community trust who continue to be brilliant partners as well. So that's my sort of non-committal answer. It's about, I think if I remember right, we can share the case, it's about 1.6 million across TeleTracking on our own investment. If I could go back and invest a little bit more in our own staff, but the return, we've done the typical bureaucratic return investment business case review of it all, and it's been very favourable every year we've done that. So it's been, you know, if I went back in time, I'd do it again.
Yeah, I mean, it's hard to give you specifics in terms of what you expect to benefit, because there'll be so many variables. But what we do recognise is that you could comfortably assume that there's at least a 3-4 to 1 return on investment for whatever you make. And if you think about the impact that the team has outlined there around the reduction in escalation space, the retention of nurses, the impact on elective care backlogs, and your need to outsource activity, all of those things are all potential savings that will be delivered against the initial investment. And then you add in all of the improvements in quality of care and what this means to patients on the ground, and the risks at the front door, all of those things that all have a significant and major value that isn't necessarily always captured, but should be right at the forefront of those decisions. We think there's real significant value in terms of the return on investment, which is in real terms relatively minimal given the impact that it can have.
Thank you for that. And yeah, and one of the questions was with regards, obviously, the investment, but also the return on investment. And I think you just shared that with regards, you know, you will be looking at 3 to 4 times what you've originally invested when you look at it in its broadest terms. But let's not just look at this in terms of pounds and pence. Let's look at it also in terms of patient outcomes, and look at it from a quality and a safety perspective. So any kind of case or business case, bid or whatever for any pots of monies, let's think about it from a workforce, quality, safety and an efficiency perspective at the same time. Louise, may I bring you in with regards particular cultural aspects?
Yeah, it was just how you manage the tension of bringing in technology, but also sometimes our staff side colleagues, especially, I mean, I'm in facilities, so especially perhaps within portering and cleanliness, perhaps, you know, are slightly hesitant of using that. I was just wondered how you'd manage that, because you also seem to have got them now in the core, which I think is really amazing and would love to have in my trust. But you know, how did you manage that?
Sorry, I'll take some of that and then I'll hand it over. So I think in terms of the general cultural change, we stopped talking, everyone's heard me say this, Carl, we stopped talking about this being a technology and efficiency tool, and started talking about it, as I alluded to earlier, as a quality tool, and started talking about patients and the benefits for patients. So our clinicians, our nursing staff and our doctors then became interested, and it was kind of pushing an open door where it was they were up for that kind of cultural change. In terms of, you're right, in terms of the facilities teams, I think Sean spoke about investment, and that was one of the areas that we had some quite large investment. So we have now got a bed turnaround team that was an added investment and part of the business case. So we actually bolstered our estates and facilities team. And actually they were part of the initial conversations. We brought them in right at the beginning because the biggest change was going to be actually to that workforce. They hold a handheld iPhone now, their job pings up. And I think we were worried that there were some anxieties from them that they thought this was a time of motion. They were worried that they were going to be performance managed about how long it took them to get to the next bed, how long it took them to the next to take the next patient from ED to a ward, but that wasn't the case. So it was about investing, showing them that we were committed to investing in that team, and actually bringing them along right from the beginning, and listening to them, and they were probably one of the easiest groups, to be honest, to influence, and probably have got the best feedback from those teams.
Yeah, and I would just add, there's a duty on behalf of the technology provider is to help enable and support that cultural change component. I know, and I've experienced it in the past, where people kind of push for the technological development, but ultimately we now build into our delivery process a period of time to make sure that we've done the engagement, got the right people involved, we're answering questions, supporting the kind of concerns that people have. So we share in that partnership, in that duty, because we know that's how you get to that value as quickly as possible, which is in everybody's interest, including the patient first and foremost. And so if we can keep the patient at the forefront of every decision that we make, then one, we all allay all the concerns across the board for all of the staff involved, but also we make sure we're making effective change along all those different parts of the system. The other part of that is we try and make sure that the training element that comes with this is as intuitive and as simple as possible. This isn't a hugely burdensome kind of technology that needs lots of learning. It's relatively intuitive. It is minimal lift where it's required. We don't ask people to continue to touch and interface with the system if they don't need to. Where we can do so, we automate process. And so really, by making it as simple as possible and putting patient at the heart of it, that cultural engagement piece becomes a lot easier, and we can kind of win trust as we move along through that process, and it starts to reinforce greater use as you move on through time.
Great, thank you. And that was one of my reflections with the cultural change. Was there any, I think you've answered it to some degree, any particular professional group that was more challenging, or flip it the other way, that one professional group that was more so wanting to get behind it involved, or was the one that stood out that was more challenging? Because I think from a challenging perspective, was there any stood out from your experience?
From my personal experience, no groups were difficult to engage with, and I think so it's important to say that I think probably the one group of people, and I hope there's no pharmacists on the call, I think probably the pharmacists were one of the not the most difficult, they were the challenging, but because I think we wanted to try and ensure that they used their TeleTracking system to kind of historically they would go from ward to ward to ward to ward to ward, any discharges today, any painted discharges, and it would be quite a safari ward round for those pharmacists. But actually, if you look at the TeleTracking system, it's very clear where your pending and confirmed discharges are for that day. So to change their way of working, to not want to go to each ward and look at a system and actually prioritise where they need to go, has proven not impossible. We're getting there, but it's probably quite difficult to change. It has been the most challenging group, I would suggest, although we are making good progress with them at the moment.
Thank you. Thanks, Sally, and thank you for sharing as well. Because I think sometimes we can often find that some things we'll go, oh, didn't expect that. Oh, never thought of that. So these little nuggets of learning and experience are really, really helpful, because it'll just making sure that we're inclusive and we're giving due care and attention to the wider professional groups. Carl, please.
Yeah, I was just going to add, because I think because we haven't mentioned it, what the first piece of work does is it creates an amount of space that allows you to then build on that for the future. So if you don't have this and you're constantly in firefighter mode, you can only ever try and kind of keep up. And what Sean, Sally and the team have done there is they've broken the back of that, and they've made sure that they've created space for the team to engage with further works going forward. And if you look at the plans that now they're putting together and we're working in partnership with over the course of the next 12 months, and then we'll go on for another 12 months, you'll start to leverage more and more benefit out, because we've released that time out of the system, and that can be so much more can be done when you bring people to the table around the exciting problems and challenges that people want to get on and tackle, but just don't know traditionally have the time to do that. So it's really just important to mention the importance of that going forward.
Thank you, Sean.
Yeah, just back to that as the cultural piece and who are the most challenging people to deal with. Try getting Sally to change a site meeting as well that she's tried and tested and sort of successfully practiced for 10 years or something. You know, that was reasonably difficult as well. So I just wanted to throw that in as well as one of the more challenging aspects. But I'm teasing. I just go back to with all of this sort of stuff. I'm convinced. I'm convinced if you've not worked on the culture and the sort of the appetite of the organisation to do something like this, and well, I can joke with Sally because she was really up for it. But I think if you've not got that, I think you can implement this system. And it makes no difference in performance at all. It makes no difference for patients. The system's good, by the way. The system is really good, and TeleTracking are really good. But Carl made this point himself. I think you've got to really. I think we had to really approach it and just go all in on it. And if we'd not done, and there were a few, you know, there were like any implementation, there were a few months where it wasn't going, you know, not in terms of the project not going well, but performance didn't dramatically improve straight away. In fact, it probably gets worse a little bit as you implement something new. So there's a little bit of pain. You've got to really commit to it at the sort of the upfront. But I think then if you stick with it, the long term gives you big benefits.
Great, thank you for that, and thank you for sharing as well. We've also asked if possible, and we will be sharing the details and the slides shared today and the recording, and it will have in there Sean and Sally's and Carl's details for people to get in touch, because we've had Louise particularly ask if it's possible to liaise with your head of facilities management as a good example, because I think these are some real opportunities where we can get further underneath and learn. So I'm sure I'm seeing nods already from Sally and Sean. That'll be absolutely fine with regards to that. So I'm just going to take a quick look. Does anyone have any? Jake, you've popped something in there. Is there something you want to particularly ask?
No, I was just trying to get some broader information from Carl. I'll probably pick it up in your information pack, but I was trying to find that. That's a new site, but it doesn't seem to be accessible at the moment. That was all.
No worries. That's fine. But what we'll do is when we'll send all the contact information out to Jake, and you'll be able to get in touch with Carl directly with regards to some of their solutions. But please, Ian.
Yeah, so we've. They're okay? No. Oh, for Christ's sake.
Have a go, Ian. Go on. We'll get you.
Is that an echo on that still or not?
Gone.
No,
No
okay.
echo.
So we've got TeleTracking installed. We've had it for since 2010, but we've got the very basic suite. We're due an upgrade. That upgrade is going to happen after the Careflow cutover, which is later on this month. With the upgrade, we have the dashboard for the reports. Do you have the dashboard? And if you have the dashboard, what benefits does that give to you guys?
Thank you. And just for confirmation, Ian, you're from Shrewsbury and Telford Trust, aren't you? I believe he is, yes. Yeah. So over to yourselves, Sean, Sally, Carl.
I think I'll give a simple terms. Carl, give us a technical. Yeah, yes, we have the dashboards and the synapse reports that come out of the back end of TeleTracking. And what it does, it gives us a daily, weekly, monthly overview of our performance across the organisation in terms of flow. The information that those dashboards and all of those Synapse report give us is invaluable to us. So yes, we have got the dashboards. Yes, we are using them. And actually our partnership, and not only have we got the kind of standard TeleTracking dashboards, we've also working in partnership to look at our IPC, our infection control dashboards, and all of the other dashboards and integrating them with our TeleTracking system. So yes, we've got the dashboards. Yes, they are immensely important to us, and we have weekly meetings to go through all of our KPIs and all of our dashboards to see where we can improve performance, give praise where it's due, and kind of benchmark our improvements going forward. So absolutely yes, and they're very helpful to us.
Thanks, Sally. And I absolutely particularly love the bit of give praise where it's due. Let's use these tools to also recognise successes where work has gone well and that team effort. I think that's as equally as important as when it's not, because sometimes we can fall to the side of when it hasn't gone well and focus on that without recognising where it has. So yeah, really great point there. So a big thumbs up for the dashboard and introduction of that. I'm just going to do a final check with regards the chat box. Just checking on there. What I do want to do is just take the opportunity to again thank Sean, Sally and Carl for sharing their work across Maidstone and Tunbridge Wells Trust and the work that they've done in partnership with TeleTracking. And I think you've got some brilliant, phenomenal results there, whilst hearing the very key message of, you know, this is significant cultural change, it's significant structural change. You're 3 years on the journey, you haven't reached an end point yet, you'll remain on that journey. But what you've shared with us are some of the outcomes from both an efficiency, a quality and a safety perspective. Then I think there's some real green shoots of opportunities there for our operational managers and teams across the UK health and care. So thank you so much for giving up your time, Sean, Carl and Sally. Like I said, we will be sending out the slides and information and the recording link to this afternoon's session. And also what will be in there is the contact details for Sean, Sally and Carl. And I'm sure they'll be well up for chatting further with you and asking any further questions and insights that we've got. So thank you so much, everyone. And thank you for joining today's Proud to be Ops Lunch and Learn session. And I really hope you have a good rest of the day. And if you have got some Easter eggs left over, enjoy. But thank you so much. Thank you for everybody's time. Take care. Thank you, everyone.
Thank you.
Thanks, everyone.